Hello and welcome to Into the Woods with Holly Wharton. This podcast is all about our journey into the woods of ourselves, getting to know who we are, and where we're going in life so that we can create the life that we want to live. It's about deepening your connection with yourself, taking inspired action, and really trusting yourself and your intuition. It's also about mindset. Our beliefs are such an important part of this journey. And there are so many ways for us to change our mindset so that we can more easily live a life of expansive joy. This podcast is also about going literally into the woods and spending time in nature, and how that can help us on our own personal journey of self-knowledge. Thank you so much for joining us today. Now let's get into this week's episode. Hello, adventurers, and welcome to the Into the Woods podcast, episode 454. This is your host, Holly Wharton, and I'm back with another exciting guest. Today, we're talking about breathing. I know this is kind of a weird topic, but breathing is important, and it's something that most of us probably don't think about. Now, I've got asthma, and according to some people, I'm a weird breather. You'll hear more about that in this episode. So it's definitely something that I'm aware of, but I wanted to learn more, and I needed to find a guest. So that's why I called on today's guest, Karese Laguerre. What I didn't know, and what I learned in this episode, was how simple it can be to fix some breathing difficulties. Karese gives some super simple tips on how we can identify breathing issues and improve our breathing today. So, who is Karese Laguerre? Karese is a registered dental hygienist and myofunctional therapist. She founded the Myo Spot, a practice aimed at amplifying oral wellness to whole body wellness. Through tele-therapy, she helps clients of all ages overcome tongue ties, TMJ disorders, sleep apnea, grinding, anxiety, and various breathing and orofacial dysfunction. Passionate about education and self-help, she published Accomplished: How to Sleep Better, Eliminate Burnout and Execute Goals. When not working with clients globally, she spends time with her husband and 4 kids. So what are you going to learn in this episode? We discuss the importance of breathing in our outdoor adventures, what we need to know about breathing, the right way and the wrong way to breathe, how improper breathing affects our lives, common causes of improper breathing, how our use of facial muscles affects our breathing, what is myofunctional therapy and how it can help breathing, Karese's top tips for better breathing, and we also discuss whether or not mouth taping is a good trick to encourage nasal breathing. Might be something you haven't heard of before, but it's something that I came across on Instagram a few months ago, and it's kind of been in the back of my head ever since. So, hope you enjoy this week's episode. Hello, Karese. How are you today?
I am well. How are you?
Good. I really look forward to talking to you about this really important but kind of niche topic.
Great. I'm so excited to be here and I can't wait to dive in.
Cool. So, can you start out by telling us a little bit about who you are and what you do?
So, I am a registered dental hygienist and a myofunctional therapist. Myofunctional therapy is not a household name yet, so I'm sure I'll have to dive in a little deeper into that. But myofunctional therapy essentially is like working with a personal trainer. So I'm a personal trainer, but for all the muscles below the eyes, but above the shoulders. So I work to help optimize everything that's going on there muscularly to improve breathing and a number of other things that kind of fall into the chain of surrounding the upper respiratory system. But that's the bulk of it.
It's interesting because I think those are muscles that we don't normally think about. And we certainly don't think about training them.
Definitely not. And there's hundreds of muscles in this complex. And so it's so interesting that people are very focused on a lot of the other muscles of the body and not really these important critical ones.
Yeah. So let's talk about the importance of breathing in our outdoor adventures. So beyond the obvious that, of course, we need to breathe, what do we need to know about breathing? Because this is something that we obviously do automatically. We don't think about it. What do we need to know about breathing that we don't know?
I think what we need to know is that how you breathe matters. So there is a right and a wrong way to breathe. And you could make it really simple by just saying, it's really important to make sure that what you're doing is nasal breathing. But even deeper than that, what I think people don't think about is that there is a way to efficiently stimulate nasal breathing so that we can get it to be optimal. So our tongue actually has a huge role in that. Our tongue should be sitting at rest. So when you're not speaking, not eating, not swallowing, not doing anything else, it should be at rest sitting up against your palate, lightly suctioned up there. Our palate is the roof of our mouth. And if you think about it, that bone, that one bone, is not just the roof of the mouth, it's also the floor of the nose.
Ooh.
So by having that tongue up there, lightly suctioned, it's going to stimulate the vagus nerve, which regulates our autonomic nervous system. It's going to help to facilitate and really establish a good signal for that nasal respiration to initiate. And so you're breathing through your nose, you're able to optimize all the air, you're humidifying it appropriately, you're able to filter it out through the nose, and you get an optimal formulation of nitric oxide, which is going to help that bind the oxygen that you're inhaling now from the great outdoors. You're binding it to those receptors so that your hemoglobin levels are great.
So why is nasal breathing preferred to mouth breathing?
Nasal breathing is preferred for a lot of the reasons that I stated. So we can't filter any of our air that comes in through our mouth. There's no way to filter it. The only way you may be able to filter it would be going through the tonsils. And then that's not really an optimal way. Our tonsils weren't designed for that, right? So if it's filtering through there, you're more likely to get more throat infections. You're more likely to get a tonsillar infection. Our nose is also where we get a lot of the nitric oxide. You don't produce nitric oxide in your mouth. And so it's not going to give you optimal oxygen. You won't be able to bind to those receptors so that it can flow through the body easily by binding on with the blood. And so it's really optimal that you're breathing the way the body was designed for, right? So there's a cool niche saying in our field where the nose is for breathing and the mouth is for eating. And so if you just use them for what they're supposed to be used for, it'll be perfect.
So why do people tend to mouth breathe rather than nose breathe?
That's a great question. So when we are born, we're born obligate nasal breathers. Like we are born with everything in place for nothing but nasal breathing. But somewhere along the lines, things have come about, or we have evolved in a way where we're not all developing appropriately. So remember I talked about the palate being the roof of the mouth and the floor of the nose. Well, a lot of our oral development is going to shape our upper respiratory system. And so if we're having a lot of pureed foods, we're not really eating or chewing appropriately, we're finding that a lot of our skulls are really developing smaller. So we have a lot more people who are winding up in braces. And so you're like, how come everybody needs braces nowadays? Like everybody's kids have to have braces. That's not normal at all. A lot of our functional capabilities have impeded how we are able to nasal breathe. And therefore it kind of requires us structurally to be mouth breathers so that we can get oxygen, because that's what the body needs above any and everything else. So we can go for a while without food, we can go a few days without water, but many of us that would survive beyond a few minutes without air.
Right. So one person that I follow on Instagram shared a picture of herself one day with her mouth taped, and it looked kind of violent, but I mean, it was the way she was kind of retraining herself to breathe through her nose by taping her mouth shut. But apparently this is a thing. This is a technique. Have you heard of this? What are your thoughts?
I have heard of mouth taping. What I can say is that, yes, it is good if you are physiologically able to breathe. If you've gotten clearance from an ENT or your physician that says, look, there's nothing obstructing your upper respiratory system and there's no reason why you shouldn't be breathing through your nose, then go at it. Like have at it, tape your mouth, it's fine. But if you don't have that clearance, just as I referenced before, structurally, your body may not be prepared to nasal breathe. You might have a small palate, which means that you have less of room in your nose for breathing, right? So you don't have the nostril space or the nasal capacity. Your sinuses aren't adequately developed. They're not able to really drain appropriately. Like there may be things that are preventing you from breathing through your nose. And so we never want to ignore that. So I love mouth taping. It's great as long as you've got all of the clearance that you can breathe through your nose. You just, for some reason, haven't developed that optimally.
So if someone currently has a situation where you say sinuses might not be developed, or for some other reason, nose breathing is difficult for them, that can be changed? That's something they can work on?
Absolutely, definitely. I think that we have wonderful abilities as humans to be very adaptable. So you can work on things. once there are physiological things that are removed out of the equation, be it surgical, be it going through some sort of expansion or appliance therapy or whatever that is, you are able to essentially reestablish new patterns, because that's really what it would be in facilitating nasal breathing once you haven't done that for a good amount of time. So it's a wonderful thing how our bodies are able to really rebound after certain events. It does take some training, but it's possible.
And I think that's interesting. It's in the beginning, you described yourself as a personal trainer for these types of muscles. And that's exactly what it is. It sounds like you've got to completely retrain, as you would your biceps or other kind of major muscles. You're retraining these smaller muscles.
Absolutely. And I really love that reference, because I think when you think of a personal trainer, you think of somebody who's essentially guiding you or holding you accountable, right? So
Yep.
I don't do all the work for you. I can't help you nasal breathe by waving a magic wand, It's really about showing you what it is that you can do. And then from there, you're optimizing it and really taking it as your own. It's a great analogy.
Yeah, it is. So how does improper breathing affect people's lives?
Oh, so many ways, so many ways. Okay, so I think I mentioned it just briefly before. We regulate our autonomic nervous system with our tongue up there. So how we breathe matters, right? So people who are in these heightened stages of fight or flight, or they're very overreactive, they would definitely see a major change by changing the way they breathe. There's a large link between anxiety, depression, and breathing. And so mental health and mental health statuses, it's incredibly important to be aware of how you're breathing, because one of the first things that psychologists do typically with people who have anxiety or panic attacks or who are depressed is they go over some breathing exercises. It's incredibly important to monitor how you're breathing when it comes to mental health as well. Just cognitively, functionally, and with sleep, nothing is more important than breathing. You can do every sleep trick in the book. You can have the most expensive mattress. You can order all of those fancy pillows. You can stop using your cell phone 2 hours before bed. You can stop eating 3 hours before bed. You can do everything right. But if you are not breathing well, you won't cycle through all your sleep stages appropriately. That's going to impact your memory. That's going to impact your brain function, your cognitive abilities. And it's definitely going to leave you in like a place of brain fog. It kind of leaves you in what one ENT has termed like a drunken mind. So you're not drunk, but it's almost like you're drunk. You're so exhausted. Your body and your brain is so fatigued from this poor sleep. Even though you might think you're getting good sleep, it's poor sleep when you're not breathing properly, that it will impede you from being able to function appropriately in the days that follow. So not breathing well can impact you in many, many ways.
And I think that's something a lot of people don't think about. I mean, as you said, a lot of people might think, oh, well, I get 7 or 8 hours of sleep a night. But if that's not quality sleep, then you're still going to suffer.
Exactly. When we're thinking about our sleep stages, every single one of them is important. But the main thing we have to remember is that our brain is doing the most work, and we get the most activity from our brain when our body is at rest. And the only time that brain is going to clean out itself, because we have many other systems to clean and facilitate. We have our kidneys, we have our lymphatic system. We're able to drain everywhere else. But the only time our brain will do it is when we're sleeping. And so if you miss these critical things, it's going to essentially take years off of your life.
Yeah, absolutely. So what are some of the causes of improper breathing? I know you've mentioned some things already, but what are some things that people might not realize?
Some things that I think people are unaware of, or maybe take a little bit lighter than they should, it might be the lip ties or the tongue ties. And when we hear about those types of words, we're typically hearing about them for babies. So like, oh, baby wasn't able to latch, or baby, for whatever reason, had to have these things snipped. Now, when we're talking about a snip, we're typically not talking about actually going in and getting a functional release. So our tongue, like I said, is super important to breathing. But if we're doing a release that is less than optimal, or it's not releasing enough of the frenum that it would be restrictive, then you're still not going to have enough mobility to be able to sustain your tongue up against the roof of your mouth at rest. And so that's going to impede you significantly. That can be at any age, any stage that is typically found. And it doesn't have to be just babies. Is it easier for babies to find it, to release it, to heal? Absolutely. Super easy. But I don't think enough of us are looking at our tongues or even aware enough of our tongue and whether our tongue is able to sit up there enough to be able to call that concern to our medical or dental providers so that we can have that reversed.
So since you started talking about this, I've been aware as I'm listening to you where my tongue is sitting.
Oh, good.
And it seems to be in the proper position. So if it's not in the proper position, where would it be? Like, what do people need to look out for?
Oh, it can be any number of places. So let's do a really quick activity together. So if you're sitting in a chair and you're listening to this, you can sit feet flat on the floor, sit up nice and tall, take a deep breath in through your nose, and then breathe out through your nose. And then one more time, but as you're breathing in, I want you to just be very mindful of where exactly your tongue is, and then breathe out through your nose. So if you notice that your tongue is hanging out low, or it's kind of hovering in the middle of your mouth, or it's pressed out against your teeth, or it's anywhere other than sitting nice and secure against the palate, which is the roof of the mouth, with no interference from their teeth, then it's not where it's supposed to be.
Okay. I think I'm good on that one.
Yay!
Yay!
Did it!
However, as I said to you before we hit record, I'm a weird breather.
What does that mean?
I don't know. My husband is always like mocking the way I breathe, like in a good natured way. But like I'm a runner. And when I run, like a lot of times my nose is stuffed up. So I tend to breathe through my mouth and it sounds like I'm dying, but like actually I'm fine. But even walking around the house, like sometimes I'll just like come downstairs, make a cup of tea, and my husband will start going, like imitating my breathing because apparently it's quite loud. So I don't know what I do. For someone who's aware that they have a strange style of breathing, like what would you recommend?
Well, first thing I would say is that if your breathing is audible in any way, shape, or form, there's a problem. Okay. So audible breathing is essentially the sound of air meeting resistance as it's going through your upper respiratory tract. Mm-hmm. So if you're exhausted, like you said, you're a runner, you're working your body, your heart rate is up, you might have to have some audible breathing. There's a little bit more exertion that's going on, right? But if you're just making tea and you're just sitting in the kitchen or the living room and you can hear yourself breathing, there is an issue. I like to liken it to snoring because it's like just regular daytime snoring, essentially. But all of it is a resistance of air as it's going through that upper respiratory tract. So something along that tract is constricted or it's not allowing enough flow of air for it to be silently passing through. And so at that point, I would say it's time to see an ENT or an airway dentist that has a CBCT, a CT scanner, essentially, that is able to scan all of those tissues, or ENT would scope all of those tissues and see where the obstruction is. So you might be breathing properly in the front or the side borders, because that's our mouth and our nose, or the front and the side borders of our upper respiratory system might be fine, but there might be some tissues that are too constricted and need to have some sort of revision or myofunctional therapy to kind of help and shape and tone them in order to get you where you should be with a nice open respiratory passage.
Sounds good. So how does our use of facial muscles affect our breathing? And I know we've talked a little bit about that, but I think there's so much going on there that we're not aware of.
Oh my gosh, there's like an immense amount that's affecting it. So when we're talking about how I kind of mentioned, you might need the myofunctional therapy in order to tone some of those oropharyngeal or whatever along the upper respiratory tract, some of those muscles there. That can be part of what's going on in the front portion of the upper respiratory tract from the oral perspective. When we open up our mouths, we have like this little dangly thing that I don't think many people know what it's called. It's our uvula.
Yes.
Okay.
I love that word. That's how I know. I always remember that because it's such a great word.
Isn't it great? So our uvula is at the base of our soft palate. Our soft palates can also not be very toned. That uvula and soft palate could be long and droopy and not able to really sit up and facilitate a nice open respiratory passageway. So that might be another thing that's blocking off the respiratory passageway. And so I definitely recommend doing exercises. Anybody who sings, I think you find that with certain notes and tones, you get a really good lift of that soft palate. The more you lift it, the more you engage it, the more that you're able to facilitate doing exercises that are going to tone that tract, the much better you will feel.
Wow. These are things that we never think about. What is the purpose of the uvula now that we're talking about it?
Our uvula is kind of our awareness. It's like the fire alarm for our oral passageway. And so if you say you're having too much in your mouth and you feel gaggy, it's that uvula telling you, hey, like all of this is not going to come down the right path. You send it back out. Like, no, this isn't going to work. So it's kind of like our alarm, our 5-alarm system. People who are trying to make themselves gag or throw up typically are touching the uvula.
Interesting. So to pull this all together, what would you say are your top tips for better breathing? How can someone get started improving their breathing?
Best tip ever is to start a nasal hygiene routine. Nobody ever thinks about it, but we've got to clean our nose. I mean, we've talked about how important breathing is to just overall health, wellness, brain function, everything. And we've got to clean our nose if we're going to facilitate a really great breathing space. So having a saline rinse, having a nasal inhaler that helps to decongest and open up the sinus passages, help to open up and like vasoconstrict a lot of what's going on in the pharyngeal passageway or upper respiratory passageway. That is a phenomenal way to facilitate better breathing by just taking care of your nose every day, establishing a nasal hygiene routine. Cleanse that nose, decongest that nose, make sure it's nice and open and primed and ready for breathing. And if you're having trouble with it and you feel like you just can't get a good breath after you've cleaned it, then consider using something that might help to open it, just holding it open. So from the outside, there's those nasal strips. Breathe Right, they make those nasal strips that holds and lifts up those nostrils from the exterior portion, the outside, or interior. You can use a nasal dilator. They're like little circles. It kind of clips along the nasal bridge, and then you're able to just hold it open from within. And so it's a really great way to help get yourself a head start on good breathing. Make sure it's clean and ready and good to go.
I think that's something we never think about. It's like we think, oh, I blow my nose and that's enough. And I have occasionally used one of those neti pots to kind of clean out with the saline. I really hate doing it.
Everybody does. I think they're amazing. I love the neti pots. They're really, really great.
Well, maybe I need to take that up as a hobby then. and after I brush my teeth, clean my nose.
Exactly. Yeah. You just implement it into your daily routine. Yeah. It's really phenomenal. It's a game changer when it comes to breathing.
Okay. Well, I'm definitely going to add that because as we know, I'm a weird breather. So we'll start there and we'll see if that improves things. So we've talked a little bit about myofunctional therapy. Can you explain to us what is it and how does it help with breathing?
So myofunctional therapy, just like I touched on before, is kind of like personal training for all of the muscles in the orofacial complex and some of the oropharyngeal complex. So we're working with those muscles below the eyes, but above the shoulders. And there's a lot of dysfunction that can happen along the chain that's going to impact digestion, breathing, sleep, the way you chew, the way you swallow, and so forth. So if those muscles aren't working correctly, they wind up developing their own patterns to make these critical skills still happen. So you can swallow incorrectly, you can be chewing and chewing only on one side. Maybe you feel like another side feels too tight or something's going on and you're not able to balance out your chewing. Sometimes people pouch food or pouch liquids before they swallow them. Sometimes they have issues where they're swallowing too much air as they're eating, or they eat really fast because they can't use their muscles appropriately or breathe appropriately. And so they have to just get in whatever they can get in and then finally get to the breathing. And so there's a number of things along the train that can cause dysfunction when you're talking about over 100 muscles in that complex and that range from the eyes to the shoulders. So what we do with myofunctional therapy is, one, we figure out where is the dysfunction on the chain. And then two, we work to remedy that. So we're working on making new muscular patterns so that we can establish first conscious habits, but then get them to habituate into unconscious patterns so that you're able to facilitate like a nice long-term solution to that dysfunction.
Mm. And so how do you determine what are the dysfunctions that a person has? Do you get on a Zoom call with them and do you watch them speak? Like, how does that work?
A combination of all those things, yes. So I do 100% virtual services. So it's definitely something that you can do over the Zoom. You can do it in like a virtual meeting. You can look at what's going on. I ask people to do all sorts of funny things that they wouldn't think activates certain muscles. Like we're turning to one side, we're winking, we're pushing our tongue in our cheek. We're doing all sorts of things to kind of see what's going on with different muscles and how they're activating. And then from there, I'm able to see, okay, well, that muscle was moving when it shouldn't have been moving, and this one was going when it should have been going, and what's going on.
And so then how long do the exercises take? I assume you give them exercises that need to be done every day. How does that work?
Yes, you picked up on it correctly. It's just like that personal training thing, right?
Mm.
So, yes, there are exercises that they would have to do daily. That's the only way to get results, just like in personal training. If you sign up at the gym with a personal trainer and then you don't do anything, you don't lose weight or gain muscle or whatever your goal is. And so, with the myofunctional therapy, we typically like them to do the exercises at least twice a day. And I try to aim for exercises or activities that are going to take no more than 10 minutes per exercise session. So we're looking at about 20 minutes a day that they would have to be doing active exercising or working on these muscles.
Okay, that seems reasonable. And how long does it take for people to see the results? Is that fairly soon or do you have to wait a couple of months? What's that like?
Typically a couple of months. Children are phenomenal to work with because you
Mm.
get changes really fast in kids. But
Yeah.
when you have habits that have been built for 20, 30, 40, 50, 60 years, and we're having to repattern muscles that have been doing the same thing for so long, it's going to take a little bit longer. So depending on the age, we can go anywhere from like 3 months all the way up to a year, depending.
Mm. Okay. And what kind of results do people notice? I mean, what kind of the first things that people see? Do they just notice that they're breathing better? Do they feel better? What are the results that they can expect?
So you can definitely expect that you will, one, absolutely have a fantastic new awareness of muscles you didn't even know existed. Okay. But two, you're definitely going to notice key areas of improvement in your sleep, in your speech, in your ability to really swallow and eat and digest significantly better. The cognitive awareness that you get just from getting better sleep is always something I hear about. People are always like, oh my gosh, I feel just so much more alive. And
Mm.
that I think in and of itself is such a great, wonderful feeling to have.
Absolutely. So you wrote a book called Accomplished: How to Sleep Better, Eliminate Burnout, and Execute Goals. Can you tell us about that?
Oh, I love this book. It is such a work of passion. I am very passionate about this and about breathing and about being aware of these muscles and the impact they have on our lives. And so I wanted to share that in a way that it would reach as many households as possible, be able to impact as many people as possible. I have wonderful tips and tricks in there as to how you can optimize your sleep so that you can get the best performance out of your brain, out of your body, just out of yourself the next day. So we're taking all of these skills that I have in the book in a wonderful like little process and plan, and then you're able to implement those so that you can be as effective as possible in executing goals that you have, be them personal, familial, or just a work goal that you may have.
I like that. So, Carice, do you have any tips that I haven't asked you about, things that we haven't discussed, anything else that people need to hear about breathing?
I think the number one tip I always have is definitely to advocate for yourself. If
Yeah.
you feel like something's off, or if you've been listening to this and you're like, I think I might be a weird breather too, it's probably a good sign to just advocate for yourself. Ask, just like I said, you always need some sort of medical clearance that yes, you are able to breathe properly. So advocate for yourself. Go to your physician. Don't let them ignore you. Tell them you're feeling such and such is going on, and continue to advocate for yourself until you get to the point where you feel satisfied that you are reaching your maximum health and wellness goals.
Hmm. I think that's a really good point because, I mean, assuming if you're walking around, you are breathing enough to stay alive, but fine tuning that breathing might be something that a doctor might not consider a priority.
Exactly. So we've got to continue to advocate for ourselves. It's incredibly important.
Good. Well, thank you so much for sharing your breathing tips with us today. I know I've learned a lot and I'm going to start a new nasal hygiene program.
Yay!
Yay! So, Karese, where can people find you online and learn more about what you do?
You can find me on most social media platforms, or at least all the major ones: Twitter, Facebook, Instagram. I am at the Myo Spot, TheMyoSpot, or I am available with free consultations on my website. You can book directly from my website. It's themyospot.com.
Thank you so much. I really, really enjoyed our conversation. I think this is a very kind of niche thing that when you fix it or when you improve in this area, I think it can make a big difference in our adventures and in our physical activity, our sports, whatever it is that we do. And as you said, even sleeping.
Absolutely. You could definitely stop your husbands from making fun of you.
We shall see. Well, thanks again.
All righty. Thanks for having me.
Thanks. Please drop me a line and let me know what you thought of this week's episode. You can email me at holly@hollywharton.com or find me online and get in touch there. If you enjoyed this episode, you might want to check out one of these marginally related episodes. I don't really have anything that covers breathing or anything like this, but here are some other ones that might be interesting for you. 436, I talk with Tori Joy Geiger. We discuss how to have outdoor adventures when you've got a chronic illness. 432, I talk with Ben Reuter about how movement is a lifestyle. 395 is a solo show, and I discuss how to know when to quit your adventures. 390, also a solo show, I discuss what to do when you don't feel like having adventures. And finally, 385, talk about how your outdoor adventures can revolutionize your relationship with your body. That's all for now. Thank you so much for listening, and remember to visit hollywharton.com/454 for the show notes on this episode. Happy trails to you. Thanks so much for listening to Into the Woods with Holly Wharton. You can find more information about today's episode, including links for topics that were discussed, at hollywharton.com. That's HOLLYWORTON.com. If you'd like to connect with other listeners and get support on your journey, I would love for you to join my private community on Patreon. That's patreon.com/Holly Wharton. That's patreon.com/Holly Wharton. Thank you so much for listening, and I look forward to seeing you next week.